Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.
Well, good evening, everyone. I'm Mike Redford, and this is the follow-up. Coming up on tonight's show, the Trump administration's crackdown on border crossings is aimed not only at slowing the flow of illegal immigrants into our country, but slowing the flow of fentanyl, which is killing tens of thousands of people. Plus, the opioid settlement funds that were approved years ago are sitting idle and unspent in some communities. What's the holdup? And there are new developments in harm reduction programs, including rescue boxes being placed throughout our community. Tonight we have three people who work in the front lines in the fight against drug abuse and addiction. But first, we have viewer feedback from last week's show here on the follow-up, where we focused on various plans to fix the roads. Here's what one of our viewers had to say when she dialed into our follow-up hotline.
You know, maybe if Whitmer would think about how long these roads last. Every repavement or whatever only lasts 3 years, and then they're asking for more millages. He needs to stop and think about that.
Appreciate the phone call, and we'd like to hear from more of you to help drive the conversation here on the show. You can do that in a variety of ways via social media on Facebook. You can email us. You can dial into our follow-up hotline to voice your opinion or suggest future show topics. And if you'd like to watch any of our past shows this season, just log on to deltapublicmedia.org. Our guests tonight, two in the studio and one dialing in virtually. We have Lori Ziolkowki. She is the Director of Community Partnerships of the Great Lakes Bay Region Face Addiction Now Group, formerly known as the Families Against Narcotics. We'll talk about that at some point. Been here before. Nice to see you.
Great to see you.
Ricardo Bowden. He is the Executive Director of Peer 360 Recovery Alliance out of Bay City. And they all know Rebekah Willard. She is a public health nurse with the Saginaw County Health Department, joining us remotely. Good to see you all. So let me just start with the Trump administration has been doing the slow the flow of fentanyl into our country. You know all about it. He's been in office almost 3 months. They have something called Operation Four Horsemen. We're going to show some information on the screen for our viewers. The U.S. Border Patrol is teaming up with DHS, Department of Homeland Security, at points of entry, and in 3 months just about they've seized 10,000 pounds of fentanyl and another 10,000 pounds of other narcotics like cocaine and methamphetamines. Seizures overall of fentanyl have dropped 22% compared to a year ago. So you guys are on the front lines of this work. Is this sort of a drop in the bucket? Are we making progress? What do you think of this approach?
I always think of this as we're fighting it on two fronts. One is the supply front and the other is the demand front. And we fight on the demand side, right? We help prevent people from being injured by substance use disorder. We help people get out of that. And then our law enforcement really does their best to try to help on the supply side. Is that a significant amount? I don't know. I've been on panel discussions with DEA professionals who say that we generally get only about 10% of what's coming in because it comes in from so many different directions. Sure. I would say getting as much off the street is a really good thing, but we can't just do that. We can't just fight it from a supply side. We also have to fight it from a demand side. If a restaurant doesn't have customers, the restaurant closes. Right. And it's the same philosophy with substance use disorder. If nobody's buying your stuff, you go out of business, and that's what I'd like to see happen.
Ricardo, what do you think of the approach from a federal government standpoint?
Well, I would hope that they would be able to reduce the flow of fentanyl.
Right.
I'm not in a position to be able to know if they are or not.
Right.
What I do see, though, are people continuing to use fentanyl, drugs released with fentanyl, and people overdosing. We also see more and more people are reaching out to get help to overcome their substance use issues, and coming out to get support for harm reduction materials, right, so that they can avoid overdosing by knowing what's in the drug beforehand and then having Narcan on hand in case someone overdoses. More and more people are coming out to get access to those services, and that's a really, really good sign.
Good. And Rebekah, I have to ask you from a public health standpoint, are you seeing the slow of fentanyl at all? We'll dive deeper into this as we go on the show, but just in terms of what they're doing on the border and whether or not it's making a difference.
I mean, we see that there's still a need for our services in the area, and it's working together with prevention, harm reduction, and treatment because it still is a problem.
Okay. Let's move on to harm reduction services side of things. It's a bit controversial, as you know. Not everybody's a big fan of what you're doing here, but I know it's making a difference. I'll let you tell that story. Because you're catering to sort of drug users, right? To allow them to exchange syringes without penalty for carrying drug paraphernalia. So kind of walk us through the strategy, including an explanation of Room 202 initiative. Rebekah, you want to start? And we have a graphic as well to show our viewers kind of what the Room 202 initiative is and kind of listing a lot of the harm reduction items that we have, and there it is on the screen. So Rebekah, why don't you start, and then the others can kind of pick up
Sure.
on
Yeah,
that.
absolutely. So harm reduction in public health is anything that we do to try to reduce harm. So that can be something as simple as encouraging people to use sunscreen, encouraging people to lock up guns so that kids don't get it, whatever it may be. So in this use, harm reduction helps make people who do use drugs safer. So I know my goal as a public health nurse in any of the work that I've done is try to make people as safe and healthy as that they can be. And this is one tool that we have to do that. So in Room 202, and then some of the other harm reduction programs, we do harm reduction education. We can provide items to people so that they can use drugs more safely. We provide Narcan and Narcan education, fentanyl testing strips or xylazine testing strips. So those are both things that people can use to know better what is in the drugs that they do have. And then it also can connect people with referrals to housing, to food services, to medical treatment, to testing, to wound care supplies, and then with a recovery coach if they are interested in treatment.
Okay, Ricardo, I know you work together both with Lori, with her organization, and with Rebekah. So tell us about the Peer 360 Recovery Alliance as it relates to kind of the work that she's doing there in partnership with.
Sure, thank you. And Rebekah, thank you so much for mentioning peer recovery coaches. Our organization is staffed by individuals, all whom have overcome substance use disorder and are living sustained lives in recovery. And one of the real benefits of that is when we are doing street outreach, we are able to meet people where they're at. They're not afraid of us. We're able to talk the language with them and reduce the barriers. And so we have outcomes like this. A young woman came to get some harm reduction supplies, some syringes and such, and Narcan. She started talking to our recovery coach about the pain she was in around losing her children. The recovery coach, who was a female who had some past experience, they started talking in a very heartfelt way in that initial first encounter. What happened from there, though, is 2 months later, this young woman got out of touch, but she did reach out to the recovery coach, and then the recovery coach actually brought her to treatment. So one of the things that happens regularly in the harm reduction world is it opens up the door for people to start thinking more about getting in recovery, getting out of active illness, and then finding the help because they can link with people that they've met on the street like us.
So where are you going in the street? I would think that would be a bit risky. You're going into maybe some difficult neighborhoods in difficult situations to do the outreach.
Well, part of the benefits of being recovery coaches is the fact that we have lived experience. We know how to navigate those spaces. And so we walk in those spaces with a lot less fear than other people may have because they have notions about who people are and what they do and how you're going to be treated based on oftentimes some false notions. People are just people. They're human beings. They know we're out there to help, and they treat us with respect.
Okay. And Rebekah, I didn't ask you, where is this Room 202, and is there hesitancy? As Ricardo sort of mentioned, are some folks going, man, I don't want to go into a public health building. I'll meet you out in the street. So how much impact and success are you having people actually walking in the door, and where is it?
Absolutely. So we are in the health department, Room 202. We're open on Tuesdays from 9 until 3:30. And we have a steady supply of participants, but we also know that there are people who aren't willing to walk into a big building that is connected with the government. And that's why it is so important for all of us to kind of work together to provide services to everybody in the community. And then there is a 30-year track record for syringe service programs. So whether that is at the health department or doing mobile outreach, they find that syringe service programs, people who are participants are 5 times more likely to get into treatment. There's a 50% reduction in HIV and hepatitis C cases in those communities that have strong comprehensive syringe service programs.
So Larry, what kind of pushback maybe are you getting? As I said, it's sort of controversial. Some people don't understand how you're sort of allowing drug users in this approach to fighting this battle. What kind of feedback are you getting?
Well, I'll
and
tell
the
you.
pushback.
Yeah, I come from this with lived experience as a
Sure.
mom. So you very well know that our daughter Amanda struggled with IV use for 4 years off and on. I'm proud to say that as of February 24th, she's 9 years in recovery now. And I had the same uneducated view of harm reduction supplies. I'm like, why would you give somebody who's using drugs the tool to use drugs? But when I had a young lady who comes out and speaks with me at a nursing class, who actually is one of Ricardo's staff, she explained that when she was at a public place and she was going to be sick and she needed to use and she didn't have a syringe, she just took one out of the sharps container in the women's bathroom. That helped me understand that people who are in active illness, they're not making healthy choices and they're going to use a substance whether they have a clean needle or not. And that really helped me understand the desperation that people have. So I liken this to when we started talking about distributing Narcan at a very high level, and there was a lot of pushback on, why would you do that? Why would you do that? We would do that because it saves people's lives.
Sure.
And that's the same reason that we provide safe use supplies, because people die from substance use disorder quickly with an overdose or very slowly over time with hepatitis C, HIV, horrible abscesses. I knew people in their 30s who have had open heart surgery because of heart valve infections. We don't want people to suffer bodily harm, and we don't want those diseases spread around our community. Providing people with safe use supplies just allows them to use in a safer manner. They're going to use whether they have them or not. So, and we also have, like Ricardo said, we have the opportunity to connect with them on a human level, and then they oftentimes seek out, I don't want to do this anymore, how can you help me?
So we're so thankful that your daughter Amanda has a successful story, 9
Yeah.
years still clean.
Yep.
So Ricardo, you've got a story to tell too. You've walked the walk, you're talking the talk, and you've been clean since, what, 97, right?
Correct.
Was any of this available to you? And if it was, would that have been changed? Would that have changed your outcome at all?
It would. I would like to think it would have changed my outcome, and no, these services were not available to me.
Sure.
I experienced overdose a few times in my active illness years and years ago. So it's really one of the things I have not forgotten. 27 years having used drugs or alcohol, I have not forgotten the mental anguish that I lived in. Oftentimes, battling myself not to make a bad choice, but the drug had such a power over me that I could not win that battle in that rational battle. And so I understand the anguish people are living in. I know the pain that they're living in. A lot of times we look at people who are using and we see behavior and we just think they don't care about people or they don't love people. They don't matter. They don't think life is valuable. They really do. A lot of people really do. It's just that the drug has them trapped. So because we understand that and we can bring that non-judgmental connection to people and the compassion that we can bring through our lived experience. And we're not the only ones with compassion. Lori and her team has compassion. Rebekah and her team has compassion. And the more we interact with people with a place of compassion, recognizing that they're in illness, they're not bad people. They're people who are trapped with a substance disorder.
Right.
I'm stumbling.
No, you're fine.
But they're trapped because the brain has been altered in how it operates. And being able to make that good rational choice is not going to happen most often because the drug has to come first.
And it wasn't overnight for you, not in terms of your recovery, but in terms of segueing into this career, this experience to try to help others. How did that happen?
Well, first of all, my sustained recovery was not overnight either. I spent 13 years from 84 to 97. Going in and out of treatment centers and getting help from other people and learning from people.
Right.
So I understand that whole process too, how hard it can be for people to get stable, even when they're really motivated and trying hard. However, once I became stable in recovery, one of the issues that was so prominent back then was HIV. And so I was able to start doing HIV planning and prevention work. Ultimately, I started going to treatment centers and talking about the importance, if you're going to avoid HIV, you have to avoid going back to active illness, because drug use and return to active illness, HIV went hand in hand.
Got it.
And so that's how my career got jump-started. And it also was an outgrowth of what's characteristic of so many of us who are in recovery, the desire to help somebody else not have to have as much suffering as we had on that journey.
Right. Amen. Great testimony. Another new initiative in our community are the Narcan distribution boxes, rescue boxes, as some call them, being placed strategically at several locations here at Delta College. For example, SVSU's main campus and the Riverfront campus. We also have the naloxone vending machines that are at the county health department. So maybe Rebekah, Lori, talk a little bit about that, why they're placed where they are and the difference those are making. So go ahead.
Go ahead, Rebekah.
Okay, yeah. So we've had a vending machine at the health department that is free for anybody who comes in during business hours. We have Narcan, we have fentanyl test strips, xylazine test strips, and condoms that people can access whatever they need. And the importance is just that that Narcan is out there. So as many locations as we can find where people can have access is what our goal is. So that can be our vending machine. That can be the new rescue boxes that are being placed by Families Against Narcotics. Or, I'm sorry, Lori.
That's okay. We're still learning too.
too.
And so the ones that are placed in the community, you know, just like with harm reduction supplies and other things, we need to have them where the people are. And so we take a look at the heat maps. We're able to see where overdoses are occurring because EMS reports that, where those are happening. We're able to see where the fatalities are happening. And we try to get those Narcan rescue boxes, which are basically old newspaper boxes repurposed for Narcan and other harm reduction supplies like fentanyl test strips or resource envelopes or sharps containers. And we put those in neighborhoods where people can have easy access to that. We're starting to see a very slow, small reduction in overdose deaths. We know that that is contributing to that. So our number one thing, first of all, to stop this epidemic is we need to stop people from dying, either by overdose or by other public health issues with other diseases. So Narcan boxes are helping to save lives. Our partnership with SVSU has been amazing. We have one here at Delta College in honor of my former AmeriCorps Vista, Nick Castros, who sadly lost his life to an overdose, and his family generously donated his memorial fund. So we could have that box here at Delta College outside the Collegiate Recovery Center, and then another one at SVSU. The health department has generously sponsored a box to be outside SVSU down in the downtown area. So we're getting more and more boxes placed. Midland's working on initiatives with their coalition. So we just know that this saves lives, and then we work together to help restore people's lives, right? That's step number one.
Right. So drug addiction and abuse, opioid abuse affects all ages, and yet are you sort of targeting a little bit the college-aged kids because they're being placed at SVSU on the campus here at Delta? So talk to us about strategically why that's happening.
So it's important because college historically is kind of a time where young people are free to make different choices. They're often exposed to things they weren't exposed to, perhaps at home or at their high school, and it's a time of experimentation. And in decades past, you could probably experiment with some things and not have it kill you or ruin your life. Kids don't have that luxury today. We are seeing fentanyl overdoses with cocaine, with fake Xanax, with fake ecstasy. Fentanyl is making its way into everything, and people who are trying to experiment, like they have kind of for decades, don't have the luxury anymore. So yes, we are getting them on college campuses, but we're also getting them in neighborhoods. And when we look at the death age ranges, it's generally between like 35 and 50 is where we lose the most people. So it doesn't discriminate on age at all, but it's important for this not to start. So we need to do more education, younger and younger. Junior high, we need to start talking about this. And not just a one and done type of a thing, but ongoing education, because kids are smart. Our daughter was smarter about what was available, how to access it. She was smarter than we were in high school. She just was. So let's give kids the information that they need so they don't get trapped in this.
So the age group, the kinds of people that are walking through the room 202 or the kinds of people you're seeing on the street, Ricardo, all shapes and sizes, all ages. Are they young? Are they old? Who are you seeing, Ricardo?
Well, individuals that I've been seeing, was definitely adult age primarily. I don't know quite age range. We don't ask them about the ages when they come and talk to us. We just ask them, how can we help? But typically they're our adults, and they're female, male, different races, ethnicities. None of that's in the way in terms of who's using and who needs our help.
Okay, Rebekah, same question. What's the range? And are people that are coming in there, are they looking to get clean? Or are they looking to just kind of get me by, get me some help, I want to do things safely, or are they looking to change their life?
Yeah, so we have participants in their 20s and we have participants in their 60s. So it really is a very large range. And our participants are looking to be safer. Sometimes that means that they're ready for recovery. And if that's the case, we have services that we can direct them to and peer recovery coaches that they can work with. Sometimes it's just about, being safe, keeping themselves safe, and then trying to keep their community safe.
Okay. Going to segue a little bit into these opioid. Oh, go ahead, Ricardo.
One comment.
Absolutely.
Is that when it comes to recovery, people can't recover if they're dead. So first and foremost, we need to keep people alive, and then treat them with respect and dignity, which gives them some reason to want to move forward and make some changes.
Very good. I'm glad you got that. That's very important. I'm going to segue over to the opioid settlement funds that were publicized. A lot of money that came down, tens of millions of dollars that have been spread throughout the country, and yet what we're hearing is a lot of that money that's earmarked to save lives and fight this drug addiction is money that's sort of being unspent. It's just sort of sitting idle. Lori, do you want to talk about that a little bit?
Yeah, so, I always look at things, was it well-intentioned? Yes, for sure. So when this money was allocated, it was allocated with not a lot of strings attached and not a lot of guidance on how to distribute it. So each community could figure it out. And that's very well-intentioned and makes a lot of sense. But what happened is a lot of the communities wanted to be very mindful about where that money is going to make sure it's being used in a proper way, and that has taken a very long time to figure out a process. Each community is figuring it out as it goes. So, there's money there. Our area, Bay Saginaw and Midland, is due to receive probably about $25 million over the next 18 years. This is blood money. This is because people died. It needs to be spent. I always say the house is on fire right now. You don't bring a squirt gun and do a little here and a little there, right? It's a raging inferno, so we need access to this funds. We understand that the folks who are in charge of making that happen have to create the process. They have to write the grants for us, and it takes a while. Days and weeks and months matter in this situation, and waiting a couple years has been frustrating for us because we know how desperately we need this money and what good we could do in our communities. But we understand the behind-the-scenes reasons for it needs to also have a good process for it.
Ricardo, can you touch on that issue at all as it affects the role that you're doing at Peer 360?
Absolutely. Similar to what Lori had to say. The differences from county to county and community to community can be frustrating for those of us who want the resources to do the work right now. We've been fortunate in our community, like in Bay County, for instance, they really insightful process, needs assessment, talk to different stakeholders, and have actually made awards to several of us. Unfortunately, though, given all the aspects of rolling out the use of those dollars, developing contracts, and all that, it continues to be a barrier. We recognize that they're working hard to get it to us. However, I see people on the street corners and people who come to our office who are suffering right now. And when we had those resources, of course, we could do more, have more people, boots on the ground, and have a deeper reach. So we're anxious to get them, at the same time understanding that the process has been cumbersome for everybody involved.
Sure. Rebekah, from a budget standpoint in Saginaw County, has this been an issue for you? Because I'm thinking about all the resources for harm reduction and the Narcan boxes. Those are expensive. Those cost money. Can some of that money be used in this current fight?
Yeah, in the future, definitely. In Saginaw County, they are, just like Lori and Ricardo said, they've been working on that process to get those funds where they're needed. So I think as we continue on in the future, we're going to see more of that usage.
Okay.
And I will also say that Mid-State Health Network, who does a lot of funding for both of our organizations, has been very instrumental in getting our teams to do the street outreach. So they've been able to fund that for us, and we're so grateful because that money came a little bit faster. We want the money from the opioid settlement funds to be here now so we can use it. We also want it to be sustainable so we can continue to do this work and help people.
I think it's wonderful to see we've got somebody from Saginaw County. We've got the Face Addiction Now group, formerly Families Against Narcotics. I've got Peer 360 always working together. Has it always been that way, or has it taken some time to get law enforcement, the courts, Families Against Narcotics, which is once called, to come together and work together? Can you talk about that process and working together?
Well, I think Ricardo's been doing it longer than I have, so I'll let you give some history.
Well, like any other profession or area of business, the territory matters have gotten in the way at times. I can say, though, as I sit here with Lori, that Fan
do it short way.
Face addiction now, right.
And Fan 5060 has really made an effort to have
Right.
conversations to make sure that we don't step on each other's toes and we maximize
Yeah.
our resources. Similarly with the Saginaw County Health Department, they're engaging with us, room 202, and in fact 5060 has a recovery coach connected with that service. So we've also been working hand in hand and doing our very best to not make sure all the resources that come our way have the greatest impact in the greater amount areas where they really need it.
Right.
So we know the importance of what we got to do.
Yeah.
This is life-saving stuff we're talking about. This really is life and death come bottom line. And so we are very committed to that vision and the work and our conversations that we have.
Collaboration is essential.
Oh, sure. And
Yeah.
anybody could answer this. Rebekah, I'm going to come to you in the county health department as a public health nurse. Are you encouraged at all, or do you feel like this fight against drug addiction and abuse, you take 3 steps forward and 2 steps back, or do you feel, is it promising? Do you feel like you're making some headway with the work that you're doing?
Absolutely. Like Lori said earlier, we are starting to see this number of overdose deaths skew down. And then every day we work with clients who are being safer, are ready to go into recovery, and just having all of the different organizations come together to support that has been a wonderful experience for me.
Lori?
May I?
Yeah,
And I'm
Ricardo.
also very encouraged
Please.
because our organization provides recovery socialization, recovery support groups, and we are seeing individuals that we saw on the street corners come for harm reduction materials are starting to be coming to our groups. So in Saginaw, for instance, we have groups that used to be like 15 people last year. They're 27, 30 people in a group. And quite a bit of that is being fed by the people's more and more desire to get away from substance disorder. And the harm reduction efforts that we do is also feeding that energy.
I'll leave it at that. You guys make a good team. Thanks for the great work that you do, working together
Thank
to
you.
save lives, as you said. And that's our show for tonight, but be sure to join us next week for the follow-up. The Trump administration wants to dismantle the U.S. Department of Education. What's the impact of that move, and how are students doing academically since COVID? In the meantime, hit me up on social media or dial into our follow-up hotline. We'd really like to hear from you. Thanks for joining us tonight. Have a great night, everyone. We'll see you next week. Welcome to the follow-up after show, kind of our web extra, the viewers that may have watched the big live show. Now we've got a little opportunity to talk a little bit more about an important subject, which is the fight against drug addiction and drug abuse. We have Lori Ziolkowki with us, the Director of Community Partnerships for the Great Lakes Bay Region Face Addiction Now group, formerly the Families Against Narcotics. We're going to talk about that in the after show quickly. Ricardo Bowden, Executive Director of the Peer 360 Recovery Alliance out of Bay City, and Rebekah Willard, who joins us remotely, public health nurse with the Saginaw County Health Department. Lori, I'm going to start with you on the after show. Your group name change went to Face Addiction Now, formerly Families Against Narcotics.
Yep.
Still FAN.
Still FAN. Thank goodness it's still FAN,
Yeah,
right?
why make the change?
I always say this is like changing the name of one of your children. It is really difficult to get used to. We're getting used to it as well. So when Families Against Narcotics started, it was started as a grassroots organization by community members who have experienced a tremendous loss. They weren't marketers, they weren't nonprofit leaders, they were just a bunch of families who at that point were against narcotics because that's what had killed their children. And so the name served us very well for a while, but now our organization has grown from an organization that had a monthly fan forum to an organization now that not only helps individuals and families, but also partners with police, judges, public health officials. Our services range so much more than just families, so we didn't feel like that fit anymore. We're also not against narcotics. We're for the proper use of narcotics, and people often ask, well, could you help someone with alcohol use disorder? In our Great Lakes Bay region, in our placements, we actually hit 1,000 people in our Hope Not Handcuffs program.
Wow.
2 weeks ago, 1,000 people that we've helped. That's a significant amount. The majority of those people, the highest number, it was alcohol use disorder. So yes, we do help people with other things besides narcotics. So the name just didn't fit. We kept the acronym because everybody calls us FAN,
Right.
thank goodness, but now we are Face Addiction Now, which just more appropriately reflects who we are as an organization.
That's a good explanation, and I'm glad we got to that. So Ricardo, Executive Director, Peer 360 Recovery Alliance, we did talk a little bit about that in the big show. Here in the after show, can you talk a little bit about the history of Peer 360, how long it's been around, what kind of things they're doing, and again, kudos to you because you're on a sustained recovery yourself for almost 30 years, so congratulations.
Thank you.
So talk about the history and how you got involved with that program.
Okay, first of all, I need to restate the importance of Mid-State Health Network. A couple of individuals there and an individual from 1016 Recovery Network, Sam Price, had a vision about how we could get recovery coaches and people in recovery to be in a standalone way, get involved in helping people bridge that gap from treatment to being successful in long-term recovery. So it launched in 2014 as it was called BAM, Bay Area, Aranac, and Benton County.
Okay.
There was a coffee pot and one woman with a car
Oh, boy.
driving around 3 different counties.
Humble beginnings
Oh, my gosh.
for both of us.
Boy, I'm glad I asked the question. I didn't know that. So.
And then in 2014, 2015, I was brought on to lead the way to become an established 501c3, find our way to more productive funding, larger buckets of money we could do more. The organization at that time became a 4-county region, and now, all these years later, we are actually in 8 counties across the Saginaw Bay region, extending over to Shiawassee County, throughout the Thumb, Aranac, Midland, Saginaw Bay. So we're really kind of got a lot of territory that we cover.
Oh my God, you should write a book. I think it'd be a great story.
I don't have time.
Okay, well, you have a great testimony in going from a coffee pot in a room into an 8-county.
Yeah.
It also shows we have a huge problem,
Yeah.
but we're servicing a lot of people.
And then central to our development was the importance of changing how we think about and provide recovery. For way too long, not too long, forever, since 1935, the message has been abstinence-only 12-step groups. And a lot of people have always fallen through the cracks. People can find their way to sustain recovery in a lot of different ways, oftentimes without support, because they can't go to a 12-step group and do recovery in a way that doesn't fit that model. So we established ourselves as an organization that would bring legitimacy and see all recovery as a pathway as valid. And so our kind of motto is all recovery, all pathways, all together. So our message is we don't care how you try to get better.
Right.
Let's just get better, right?
Yeah.
Let's just get better.
It's not one size fits all. We're
No.
getting better at it. Be innovative, right?
Well, and there's a lot of paths
Yeah.
into substance use disorder, and thankfully there are a lot of paths out. We don't dictate which path you take.
Right.
We're just here to walk with you along that way, shine a flashlight out of the dark woods, and let us help you. The thing that
Sure.
I love about FAN the most, and selfishly as a mom who went through this, is we are trying to create an ecosystem of multiple pathways for recovery for family members. Because there are a couple of 12-step organizations for family members, but that's the only thing kind of there is, right? There wasn't a whole lot.
Sure.
So now we offer family recovery coaches. So just like somebody could get a peer recovery coach, I could have had another mom who's been through this help me.
Boy.
We have curriculum around that. We have Stronger
Sure.
Together meetings that are talk about grief, guilt, enabling, control, setting healthy boundaries. So we are trying to create that ecosystem because this impacts the individual, and there is a ripple effect with the
Sure.
immediate family, the extended family, the community, the friends, the employers, all of us. We need to be mindful that it's not just the person suffering.
Sure.
We suffer too. And so we want to make sure that we're caring for everybody.
Okay. Moving to Rebekah now, our public health nurse. We talked a lot about these Narcan distribution boxes, vending machines. You've got some Narcan with you, and I think you're going to kind of show us maybe how to use it, what we need to know about that.
Yeah, so first thing I always like to mention is that I recommend everybody has access to Narcan because it's not just people who misuse drugs who might need it, but it's also people who are on pain medications, people who may have pain medications in the house and have kids or pets that can get into it. So whether you have it in your home, in your car, in your purse, it can be an important tool for all of us. So when you do have a box of Narcan, it has 2 of these nasal sprays inside of them. So all you do is open up the box, put it in somebody's nostril, just like Flonase, and then push the button on the end. Very simple. They make it very simple on purpose. And another important thing to remember is it's not going to do anybody harm if they're not overdosing. So if you do come across somebody, if you're not sure what their medical emergency is, but they're not breathing well, they might have cold or clammy skin, you can still give them that Narcan or naloxone is the generic name, and it is safe to do so, and then call 911.
Okay. And we know that folks are utilizing this Narcan at the boxes and the vending machines where they've been placed,
So
right?
the fan boxes that we placed last year, I just pulled the numbers, we distributed over 2,500 boxes of Narcan. And we're only one distributor. In Bay County, our Bay County Prevention Network distributes Narcan. The health department does. The Midland Coalition, Prevention Coalition is starting to get Narcan into the communities. So we know it's going out. We know that it is. And I believe that that is contributing to some of those decreased overdose deaths.
I'll leave it at that. Go ahead.
On a graduate level, just very recently, a young woman came back to talk to us at our outreach site who had gotten Narcan from us and had gotten fentanyl test strips. And so she and her friends were using together. They tested the drug to see if fentanyl was in it, to make a decision whether to use it or not. Her friends both used it thinking they could get away with it, and they overdosed. She had Narcan available. She reversed those overdoses. And when she came back to talk to us, she said, we had literally saved her lives. Because just like we all, we put the materials in their hands, tell them, teach them how to use it, and they are using it, just like in that situation I just explained.
Fantastic. Ricardo Bowden with the Peer 360 Recovery Alliance, thank you so much for your work. Lori Ziolkowki, it's always great to see you with Face Addiction Now.
There you go.
And Rebekah Willard, Public Health Nurse, Saginaw County Health Department. Thanks again for joining us on the live show and here in the after show. Keep up the great work.
Well, thank you very much.
Thanks for having us.
And thank you, our viewers, for joining us on the follow-up after show.
Thanks for watching. If you enjoyed this video, please like, share, and subscribe. And make sure to click that bell icon to stay notified when we upload new content. Videos like this are only possible because of viewers like you. To help support this channel, click on the link in the description below. We'll see you next time.